Hello everyone, my name is Dr. Marina from Romania and today I am going to present you the topic of hypertension. First of all, we will start with the definition of high blood pressure and afterwards we will continue with elements of diagnosis and treatment of this condition. Hypertension is defined as blood pressure that is higher than normal. Here is a table that categorizes the blood pressure in normal. Pre-hypertension means a systolic blood pressure between 120 to 129 over a diastolic blood pressure lower than 80. Hypertension stage 1 is defined as a systolic blood pressure between 130 to 139 over a diastolic blood pressure of 80 to 89. Hypertension stage 2 means a systolic blood pressure of 140 or more over a diastolic blood pressure of 90 or more. And afterwards, hypertension stage 3 or crisis hypertension is defined as a systolic blood pressure of more than 180 over a diastolic blood pressure of more than 120. High blood pressure is not immediately diagnosed after one reading. It is diagnosed after 2 readings on 2 separate occasions, and this can happen at home or by 24-hour ambulatory BP monitoring. The investigations that need to be pursued to help quantify risk are the following: fasting blood sugar or fasting glucose level, and cholesterol. In order to look for organ damage, these are useful investigations: EKG or echo and urinalysis. Apart from the primary hypertension or essential hypertension, there is the so-called secondary hypertension caused by an existent medical condition that raises the blood pressure, such as renal, cardiovascular, or endocrine disease. Therefore, in order to exclude secondary causes of high BP, these paraclinical investigations need to be taken into account: calcium levels, electrolytes, and urea. In prehypertension, the treatment refers to simply lifestyle modifications. Lifestyle modifications include an adapted diet to this medical condition, focused especially on the salt intake that should be lower than 2.5 grams per day, and also on the potassium intake that should be increased. These diet changes include a limitation in alcohol consumption as well. Regarding high BP stage 1, the treatment focuses on the possibly existent comorbidities alongside lifestyle modifications that should be applied. If the patient has no comorbidity, there needs to be a follow-up in 3 months, and the medication applied afterwards, if considered needed, can be thiazide, ACE inhibitors, or calcium channel blockers. On the other hand, if the patient has associated comorbidities, follow-up is within 1 month, and the medication that can be used afterwards, if considered needed, can include beta blockers or ACE inhibitors as well. If the patient suffers from chronic kidney disease, then the best medical treatment regarding the antihypertensive drug class should be ACE inhibitors, except the case with stage 4 kidney disease. And for diabetic patients, ACE inhibitors are perfect as well in the treatment scheme. Regarding stage 2, in this case we follow the same lifestyle modifications, and there are also some antihypertensive drugs which we are going to discuss in the next slide. Beta blockers help in reducing the heart rate, thus decreasing the blood pressure. Diuretics increase urination, which in turn reduces the sodium and fluid content, resulting in lowering blood pressure levels. ACE inhibitors widen the blood vessels, thereby reducing the blood pressure as well. Angiotensin receptor blockers help relax the blood vessels to lower the blood pressure. Calcium channel blockers reduce the amount of calcium entering the heart muscles, therefore reducing the heart rate and also controlling the blood pressure levels. Alpha blockers relax tunica media of the arteries and veins, so their muscles actually, thus reducing the blood pressure. And in the end, renin inhibitors, well, they inhibit the enzyme that favors the production of angiotensin. Angiotensin constricts blood vessels. Now we are going to discuss about some antihypertensive drugs and their side effects. First of all, beta blockers. They can lead to bradycardia. The side effects of thiazides include hyperglycemia, hyperlipidemia, hypokalemia, and hypercalcemia. The side effects of loop diuretics are ototoxicity, hyperkalemia, and metabolic alkalosis. Calcium channel blockers can induce peripheral edema and uncomfortable or infrequent bowel movements. ACE inhibitors are mostly known to induce coughing, but they can also lead to angioedema and hyperkalemia. And angiotensin receptor blockers can cause hyperkalemia as a side effect as well. Now, if you liked this video, please subscribe, like, and even share our content with your med school colleagues. And stay tuned for upcoming videos. Bye!